Hello, my name is Dr. Carpino, and I'm faculty here at the University of Mississippi School of Pharmacy based in the Jackson campus. I'm super excited to have the opportunity to work with you this week in the Skills Lab related to fever, cough, cold, and pediatrics. For as long as I can remember, I've loved working with kids of all ages. Currently, I practice in the neonatal intensive care unit where I have the opportunity to work with the youngest and smallest patients in the state. However, I love being able to work with pediatric patients of all ages, whether they are a neonate or as they progress into their adolescent years. This week, we're going to talk about a variety of topics with a specific focus in pediatrics. We'll talk about the potential, unfortunately, for dosing errors. We'll talk about measuring devices that are appropriate to use when measuring oral medications for pediatric patients. And we'll also talk about communication. Whenever you have a pediatric patient, yes, you definitely need to talk to the caregiver or parent, but it's also important to include the pediatric patient as well. And then we'll also talk about some special considerations with the different fever, cough, and cold products as it relates to pediatrics. Learning objectives for today are to first describe potential for dosing errors, to compare and contrast measuring devices used to measure liquid medications, to identify strategies for communicating with children and caregivers, to interview a caregiver using the Quest Scholar MAC method, and finally, to determine medications appropriate to use for the management of cough, cold, and fever in children. We are first going to review some of the literature that's available regarding, unfortunately, dosing errors. One study conducted included caregivers whose children were prescribed liquid medications in the emergency department. The caregivers were evaluated to see if they could measure the dose of the oral medication accurately. Overall, 41.1% of caregivers made an error in measuring the prescribed dose. And of course, we never want an error to occur. However, over 40% is definitely a concerning percentage to see. Another study conducted was an experimental study that included 302 caregivers presenting to pediatric clinic. And in this study, caregivers were observed using measuring devices such as dosing cups, droppers, dosing spoons, and oral syringes to assess for dosing accuracy of 5 milliliter dose. Greater than 85% of caregivers measured the dose accurately while using the dropper, dosing spoon, or oral syringe. Of note, the dosing cup was not included in this percentage. Although 85% is a very high number, of course you never want any percentage of errors to occur. And of note as well, dosing cups were actually associated with an increased chance of making dosing errors compared to the oral syringe. And if you think about it, a lot of the over-the-counter products available come with dosing cups, and so it's important to think even in a straightforward 5 milliliter dose, there were errors associated with the dosing cup. The last study we reviewed was talking about the potential error with various measuring devices. And now we're going to talk a little bit more about the different measuring devices available. One study evaluated the availability of measuring devices available at 22 area pharmacies in Tulsa, Oklahoma. A total of 58 devices were collected in this study, and of note, all of the devices had milliliters listed. One of the purposes of this study was to evaluate the most common devices that were available in the different pharmacies. And so the only device available at 14% of pharmacies was the 5 milliliter syringe. Also, the smallest measurable volume was 0.01 mils and the largest volume was 30 milliliters. This is important to think about because sometimes in our smaller, younger patients, they may require tiny doses. And so sometimes if the increments on the measuring devices are larger increments, we may not be able to accurately measure the volume for these patients. When thinking about measuring oral solutions, not only is it important to think about the measuring devices available and the measuring devices that are appropriate to use, it's also important to think about different barriers our caregivers and patients may face. One of these barriers is health literacy, essentially someone's ability to understand the health information that is presented to them. And it is found that a decrease in health literacy is actually associated with the use of improper measuring devices and measurement errors. So it's also always important to think about the barriers our caregivers may face and how this could impact the ability to correctly measure and administer medications to their children. And of note, one of the things that can help when measuring oral solutions is to always use milliliter based dosing. And one of the reasons why is if we use teaspoons or tablespoons, there's room for misinterpretation with these units. And also, sometimes a teaspoon, which is 5 mils or 4 milliliters, could actually be a big difference for a patient, and you don't want to always just round that number up to a teaspoon. Another reason too is if a caregiver hears you say teaspoon, they may just pull a spoon from the drawer in their kitchen, and that may not be accurate. And so that links back to not only do we want to use milliliters specifically, it's also important to think about measuring devices where we can precisely measure the volume that's prescribed for patients. And so one of these devices is definitely syringes. So oral syringes are definitely one of our preferred devices to use and really should be dispensed with medications that patients will need to take. Now we're going to transition for a little while from thinking about how to measure medications to how we need to communicate information related to medications to not only our caregivers or parents, but also our patients. When thinking about communicating with children, I think it's first important to think about potential barriers or difficulties there may be and facilitators or strategies that could be beneficial. I'm going to spend a little bit of time talking about barriers and facilitators that were identified in your pre-reading article. I'm first going to talk about some of the barriers identified, and I think the article did a good job of dividing these barriers into those that related to the child or parent and then related to the pharmacist. And so some of the barriers related to the child or parent, one of them included absence. So it's really hard to counsel a child regarding their medications if they don't come in with the parent to the pharmacy. Another one can be distracted or when children have a limited attention span. And so if you think about it, if we're trying to give too much information to a child, it could be really hard for them to focus because of that level of distraction or having a limited attention span. Another thing that can link back to their age. And so in a little while, we're going to talk about the developments, different stages of development with children and techniques that would be appropriate for counseling each age level. Another barrier is definitely a child's comfort or personality. A lot of children may be shy, and if you think about it, a lot of children are told never to talk to strangers, and they may have never seen you before, and so they may not feel comfortable talking to you about anything, let alone their medications. And then another barrier is parent preferences or time. If they're in a hurry, they may think it's just easier for them quickly to get the medication and not include their child in the counseling session. And then there's also those barriers that are more pharmacist related. So a big one is the unconducive environment. If you think about it, sometimes it's very noisy in the pharmacy and there may not be a real quiet area where you can counsel a patient. And if you also think about how I mentioned one of the barriers for children is a limited attention span, it could be hard if not only do they have a limited attention span, but they have difficulty focusing. And if it's in a noisy environment, that could definitely be a barrier or a challenge. Other barriers related to the pharmacist could definitely be time constraints. They could be busy and, it could take definitely more time to counsel not only the caregiver, but the child as well. And then also a big one could be lack of experience working with children. So pharmacists may not feel comfortable communicating with children in general, let alone their medications. I definitely feel like I wasn't always comfortable communicating with children until you got more experience. I think it's definitely something that takes some practice, getting used to and learning some of the techniques and strategies. So hopefully this skills lab and this pre-lab will be helpful for you in feeling a little more comfortable if you were to have a child come into your pharmacy with their caregiver and want to counsel them. And so then there's also facilitators or strategies that could be helpful. And some big ones are devices or technology. There are a lot of different apps these days that can be used to help counseling children and kind of adherence reminders and that kind of thing, setting alarms. Other facilitators can be the demeanor and communication approach. And so we'll talk about some of those techniques or strategies. Also having educational materials or handouts you can give but are in a child-friendly manner. Also, a facilitator can be really your older children are able to understand the information, so that can be helpful when communicating with older children. Having a console area where you can talk to them, and that would help kind of eliminate the barriers we mentioned earlier of having an unconducive environment. And then also pharmacists having training in communicating with children. And so again, hopefully this lab will help you feel a little more comfortable with that. I mentioned earlier that one of the barriers identified was age or attention span. And so it's really important to know the different cognitive developmental stages by age group. And this then can relate to how you can put that into practice when counseling patients. And so the first age group is 0 to 2 years of age. And the stage of development is sensory motor. And a key feature of this stage is that they're unable to make a connection between outside objects and self. The next age group is 2 to 7 years of age, and the stage is called pre-operational. And so one of the key features is that they're able to focus on a single aspect of a situation and the here and now. They're unable to make connection between cause and effect, and they do find it difficult to conceptualize time. The next age group is 7 to 11 years of age, and their stage is called concrete operations. And one of the key features is they're able to focus on multiple aspects of a situation. So in our 2 to 7 year group, they were pre-operational, so they were only able to focus on a single aspect, whereas this age group, they're able to focus on multiple aspects, which is one of the key differences between those two stages. They're also able to understand observable and concrete situations, and they're able to, however, they do find hypothetical situations challenging. The next age group is greater than or equal to 12 years of age, and their stage of development is formal operations. And so one of the key features is they're actually able to rationalize through hypothetical situations. And so this is actually one of the differences between our 7 to 11 years of age group, where they find it difficult to rationalize themselves through hypothetical situations. This age group, greater than or equal to 12, is actually able to rationalize through those situations, and they are able to demonstrate logical reasoning. And so now we're going to transition into how we can relate this information as healthcare professionals when we're trying to counsel them on medications. Now we're going to discuss how we can apply the stages of development to healthcare and medication counseling. So for our first age group, the 0 to 2 years of age, if you remember, I said that their stage of development is sensory motor. And what this means is they're unable to make connections between objects and self. And how this relates to healthcare is they're unable to be involved. They're just too young, and so it's not possible for them to learn about their medications. So for this age group, we're going to rely solely on the caregiver and parents. Now the next age group is our 2 to 7 years of age group. And if you remember, I said that they're the pre-operational stage of development. So they're able to make or focus on a single aspect, and they're unable to make connections between causes and effect. And so since they're unable to make connections between causes and effects, this relates to healthcare by they're unable to make connections between actions and their health. So some tips are you can definitely include hands-on activities for them. And one of the things they really like is to know the taste of their medication. So that's a single aspect they're focusing on. So you can say you're going to take this liquid that tastes like cherry. And so an example I have written here is you'll take your medicine in the morning when you eat breakfast and your mom will help you. This medicine has a cherry taste. And so one of the things they have difficulty conceptualizing time. So if you make it clear cut that your breakfast, so they know that they eat breakfast, and so that they can correlate with that. And again, since they like knowing the taste of medications, you can discuss it's going to taste cherry. And now the next age group is the 7 to 11 years of age. And if you remember that their stage of development is concrete operations. So they are able to focus on multiple aspects and they're able to understand concrete situations. And so how this relates to healthcare is they are able to understand preventable diseases. And so it's important to explain concepts and encourage them to ask you questions and discuss side effects. So they do want to know these things. So I have an example here that you could say to them, this medicine will go to your lungs and make it easier to play. You will take your medicine in the morning before breakfast and at night before bed. The medicine could cause white patches in your mouth, so it's important to tell your mom if you see any of these. And so you're explaining the concept that it's going to go to their lungs and make it easier to play, so they know why they're doing it. And then you also tell them a side effect. So you don't say thrush, but you say white patches so they know what to look for. However, they're too young in the sense that they're not going to know what to do about that side effect. So that's why the important counseling is if you see these white patches, tell your mom, tell your caregiver. And so our last group, our older group, the greater than 12 years of age group, if you remember that their stage of development is formal operations, so they are able to hypothesize situations and are good at logical reasoning. And so how this relates to healthcare is they can comprehend how diseases occur and that they can really manage their health. And they really can receive information at a similar level as an adult. And so an example that you could tell them is this medication helps you breathe better by reducing mucus in your lungs. It is important to take the medicine in the morning and evening each day when feeling okay. Have your parents help you incorporate your medicine into your daily routine. So this is something, again, very similar as an adult. You're explaining a little bit more science behind it. So instead of in the 7 to 11, when you said it will go to your lungs, make it easier to play, you're actually saying it's going to reduce that mucus. So you're using more technical language that they can understand, though. And then telling them, still have your parents help you, but you still want them to take that ownership as well. Since we've discussed how to communicate with children regarding their medications based off of the different stages of development, now I'm going to spend some time providing some general tips on communicating with children. One of the first tips is, involve them as much as possible in the counseling session. I think it's really important for them to feel empowered and included in the counseling session. I think one of the biggest tips I can give you is to discuss non-medication topics with them first. I think the first time I counseled a child regarding their medications, I remember the first thing I discussed was their medications, and you want to build that trust with them. And so I think it's a lot more effective to not jump into the medications, but ask them questions. If they have a sports jersey on, you can ask them about their favorite team or that kind of thing. Or if it's summer, you can ask about their summer plans. If they do sports, that kind of thing, just to kind of get on their level, communicating with them on non-medication topics first. And I think this can be really, really effective to gain their trust. Another technique or strategy, if it's feasible, is it's best to sit at eye level, because I remember, again, the first time I counsel a child, I just walked right in to the room, was standing up, and jumped into the medications. And again, to make them feel more comfortable, if you're sitting where they can see you at eye level, that makes them feel more comfortable in talking with you. And then again, communicating at appropriate level. So implementing some of those tips and strategies we discussed based off of their stage of development. So it's definitely important to know the age of the patient you're communicating with. And I think definitely being patient and encouraging. Sometimes it may take them a little while longer to provide you that information, and that is okay. Give them that time, and also provide them encouragement. If, say it's that you're having them demonstrate teach-back method with an inhaler and they didn't get it quite right, that's okay. You can provide them encouragement, good job, and you can help them tweak it, because you don't want them to make them feel like they messed up. You want to provide them positive reinforcements. That way they can trust you and feel comfortable communicating with you. I think it's important also when discussing strategies or say adherence, it's really important to involve them in the plan as much as possible to make them feel included, instead of they're just told they have to take the medication every day, but help them come up with techniques to make it easier for them. Whenever possible, definitely employing demonstrations of different devices such as inhalers can help. And one thing that I found is it can be helpful if you show them first how to use the inhaler before you expect them to do it. That way they feel more comfortable, because sometimes they find it helpful to see it first before they actually do it. And then another strategy is to employ the teach-back method. With that being said, it's important to also include the parent or caregiver in the teach-back method, but you can include both of them, and it's really, really important to make sure they feel comfortable being able to do what they need to do and that they're able to relay that information to you. Now I'm going to provide some general tips on how to communicate with caregivers as well. So I think a big thing is to let them know first that you'll be asking their child some questions about their medicines, and you want to try to give their child a chance to answer first. I think naturally sometimes caregivers want to jump right in, but I think it's important early on to have kids get used to answering questions about their medications, because I remember sometimes I've had patients who are a lot older in their adolescent years who really aren't able to answer many questions, and I think part of it is that they're just used to their parent answering them for them. And so that's why if you can get in that practice, I think that will be beneficial for them moving forward. And let them also feel comfortable, the caregivers, in expressing any concerns, providing any missing pieces that their children don't provide, and that they can ask questions as well. So they definitely want to be included. It's important that you include them in the session as well, but it's important to make sure they give their child a chance as well. I think it's also important to discuss the level of involvement their child has or should have in administering their medications, and encourage autonomy when appropriate. And again, this will go back to how old the child is. And then, like I mentioned earlier, with the children, you also want to employ the teach-back method in involving, again, the child and the caregiver. I've talked a lot today about communicating strategies with children and caregivers, and now I'm going to talk about a general approach you can use to obtain information from children and caregivers. And so this can be applied whether it be that a caregiver comes into your pharmacy wanting a recommendation of a product for their child, or if it's a caregiver and child comes into an outpatient asthma clinic for you to interview them and provide recommendations for their management of care. And so it's just going to be different the way you ask the information, whether it be a child or a caregiver. And so what I'll say is, if you are interviewing the child, it's still definitely important to rely on the caregiver to fill in any missing pieces of information and help them answer questions if they have difficulty answering them. And so your QU is to quickly and accurately assess the patient, and this can be through interview with the caregiver and patient. And so then your symptoms. And so you can ask the caregiver symptoms, definitely, but if the child's there, it's good to get them involved. And so you're just going to have to phrase your questions a little bit differently with a child compared to an adult. So a symptom, if it's an asthma patient, you can just simply say, have you been coughing at all, or wheezing, and those kinds of things. So characteristics, you can ask them for more information. If they're having a cough, you can say, are you coughing up anything that's green? Are you spitting up anything that's green? And so you can give them some specific examples of questions. So history, onset, location are different things you can discuss. Aggravating factors is a big one. And so for asthma patients, one of the things you can say is, do you cough more when you're running at a recess or in gym class and that kind of thing? Remitting factors, an example could be when you use your inhaler, does the coughing or wheezing get better? You can ask them about their medications. Sometimes they may need more prompting. And so, for example, one of the things you can ask is you can ask them if they're on an inhaler, and sometimes they don't know all the names, so they love colors. So you can ask them, is your inhaler orange, red, that kind of thing, and that can help you pinpoint what medications they're on. You can ask about allergies and then any coexisting conditions. So essentially you're going to get the same information you always would with the Quest Scholar. It's just going through different ways to ask those questions. And so your E, so establishing that the patient is appropriate self-care candidate, S, suggesting appropriate self-care strategies, and then also T, so talking with the caregiver and patient as well. Now we're going to transition into talking about specific cough, cold, and fever products that we can use in some special pediatric considerations. Now we're going to focus our attention for a minute on cough with a specific discussion on the treatment approach and then exclusions to self-care. So I think it's always important whenever you're obtaining information from a patient to first obtain a good medical and medication history. And this is really important to determine if they are a candidate or an exclusion to self-care. So if you do determine that they are a candidate for self-care, it's important to get more information about the symptoms they're experiencing to help guide our therapy. And it's also important, once you do that, to look at how long the symptoms have lasted. And if they have improved, that is great. However, if they haven't improved with specific focus on cough in 7 days, then they do need a medical referral. So this is just important to recognize the general treatment approach for cough. So I mentioned earlier that it's always important to think about exclusions to self-care, and I have listed on this slide some key exclusions to self-care as it relates to cough. And I think an important one is definitely children less than 4 years of age are considered exclusions to self-care. And one of the reasons this is because a lot of our products that are available over the counter are not labeled for patients less than 4 years of age. Another one is if a patient has a fever, but it's a specific temperature cutoff. And so greater than or equal to 103 degrees Fahrenheit for adults, or a temperature of greater than or equal 102 degrees Fahrenheit for children, specifically greater than or equal to 4 years of age, because children less than 4 years of age are already considered an exclusion to self-care. Another thing is it's important to think about the duration of cough itself. And so if there's been a cough greater than 7 days, this would be considered an exclusion. Other exclusions relate to if the cough is of thick green, tan, or yellow mucus. If a patient has certain comorbidities, specifically asthma, COPD, congestive heart failure, or chronic bronchitis. And so asthma is definitely a big one within the pediatric population. And this would be considered an exclusion because the cough could be associated with worsening or progressing asthma. And so we wouldn't want to use an over-the-counter product. We would need to adjust the specific asthma treatment. And then also if a cough is associated with chest pain, chills, cyanosis, coughing up blood, night sweats, and there's some other symptoms as well, because this could be a sign of other comorbidities or conditions, so we would need to evaluate them further. And then also if a cough is specifically caused by potentially a drug, such as an ACE inhibitor or an irritant. Now I'm going to spend just a minute to talk about the general treatment approach for cold. And so again, just like cough, it's important to evaluate if a patient is a candidate for self-care. And then it's always good to encourage non-pharmacologic treatments as well. And then to really, in order to figure out what the best product would be to use for a patient, it's important to identify what the primary complaint is. Is it related to cough itself? Is it related to allergies or a cold, to identify what treatment we should use? And so if it's specifically a patient having congestion or a runny nose, you can use a saline nasal spray, a decongestant, or a humidifier. So that's why it's important to use those non-pharmacologic strategies as well. If the primary complaint is related to allergies, then antihistamines can be used. If a patient's experiencing aches and pains, then you can use systemic analgesics. If a patient is experiencing a fever, can use antipyretics. And then so if a patient is experiencing pharyngitis, then local anesthetic sprays, lozenges, and gargling can be beneficial. And again, gargling would be one of those non-pharmacologic strategies, which is really important. Just like cough, there are key exclusions to self-care for cold. And similarly, two of our main exclusions are related to age and temperature. And so for cold, infants less than 9 months of age are exclusions to self-care. If patients have a temperature greater than or equal to 101.5 degrees Fahrenheit, this is also considered an exclusion to self-care. Other exclusions are chest pain, shortness of breath, and then if they have worsening of symptoms, even though they've tried self-care treatment, comorbidities, similarly to cough, asthma is a big one, frail patients of advanced age, or patients who have hypersensitivity to available over-the-counter products. Now I'm going to spend just a few minutes reviewing some of the different over-the-counter cough, cold, fever products that are available, and then I'll transition to talk about some specific pediatric considerations. So two of the main components in a lot of our cough products are an expectorant and or a suppressant. And so the ingredient for your expectorant is guanfacine. And so an example of a brand name product is either Mucinex or Robitussin. And so these are both very common over-the-counter products that you will see. And your suppressant, the active ingredient is dextromethorphan. And so a common brand name would be Delsum. And then sometimes they can be packaged together in combination products, and so I have some of those listed here. And so examples would be Mucinex DM and Robitussin Cough DM. So it has that dextromethorphan or your suppressant in it as well. There are also some nasal decongestants that are available, and these products are either available as a topical intranasal spray, such as Afrin, or there's also oral products that you can take that can help relieve nasal decongestants. An example would be Sudafed PE, which has phenylephrine in it. As a reminder, pseudoephedrine is a prescription-only product in the state of Mississippi. And I will say that these nasal decongestant products are not recommended in patients less than 6 years of age unless they're under the supervision of a pediatrician. There are some topical products available that are cough suppressants, but they're analgesic ointments, and specifically Vicks Vapor Rub. and I have the picture listed on the top right here. And this product contains menthol and camphor, and I can't stress enough that you do not want to use this product in children. There have been case reports and when patients or children have had respiratory distress and passed away, unfortunately, and so this is a product you do not want to use. However, there is a specific children's formulation, Vicks Vapor Rub Children's Topical Cough Suppressant Ointment, and this product is okay to use in children. It does not contain the menthol and camphor, and it's indicated infants greater than or 3 months of age, and so that is something that is okay to potentially use, but you want to make sure you don't have both products at home, because then you easily could mistake one for another, and so you have to be very careful with the use of these products. I mentioned earlier, for the treatment or management of cold, it's important to look at what the primary symptoms are. And so if allergy symptoms are more your primary symptom, you can use antihistamines. And I have listed on the slide some examples of your first versus second generation antihistamines. And I will say there are some specific children's formulations of some of these antihistamines that can be potentially used. If a patient does in fact have a fever, antipyretics can be used, but you do want to be cautious in recommending the use of these products if their temperature is so high that they would be an exclusion to self-care, because you do want to make sure they seek the appropriate medical attention, but over-the-counter antipyretics definitely can be used. Two common ones are acetaminophen or Tylenol and ibuprofen or Advil. And so I think two precautions to make note of for your Tylenol, a precaution definitely is hepatic impairment, so you do want to be cautious of that. And there is specific pediatric dosing for Tylenol, and I have that listed here. So mg per kilo dosing is what we use, so 10 to 15 milligrams per kilogram per dose by mouth every 4 to 6 hours. But an important counseling point is there's a maximum of 5 doses that you want to use in a 24-hour period. And there's also a maximum daily dose, which is 75 milligrams per kilogram per day. And with ibuprofen, a specific precaution is renal impairment. And again, there is pediatric dosing available, and this would be 5 to 10 milligrams per kilogram per dose by mouth every 6 to 8 hours, with a maximum daily dose of 40 milligrams per kilogram per day. And we'll go into some detail during the skills lab about specific dosing and how to kind of determine what the appropriate dose for these products would be, because this is something you will commonly see in the retail setting. I will also say that ibuprofen is not approved for infants less than 6 months of age. So if you have an infant, acetaminophen would need to be the antipyretic you use. Now that we've discussed some of the different products available, I'm going to touch on some specific patient population considerations. One being, so any decongestants can actually exacerbate BPH, diabetes, glaucoma, hypertension, hyperthyroidism, and ischemic heart disease. So that's something to be cautious of. In the elderly population in general, due to the risk of sedation, you want to use caution with antihistamines. And then in pregnancy, you also want to avoid the use of decongestants and codeine. And use of antihistamines specifically is contraindicated. And I'll say in general with pregnancy, the way I'd approach this is you always want to weigh the specific risks with each medication and the benefits for all of your options. There are some specific pediatric considerations to take into account with these dosage forms and medications. And so you want to avoid decongestants, cough suppressants, and antihistamines in children less than 2 years of age. You also want to avoid any product that contains codeine. And the reason why is because codeine is converted to morphine, which is one of your opioids. And if in some situations, pediatric patients metabolize codeine rapidly, and when they do this, they actually end up getting a lot more morphine than is intended, and unfortunately then this can lead to respiratory depression. So this is why you don't want to use products containing codeine in pediatric patients. And as I mentioned earlier, most of our over-counter product labels state do not use in children under 4 years of age. So this is why they're often an exclusion to self-care just based on the age alone. And then also you want to use caution with all products in children. And so it's key to look at the product labels with the focus on your ingredients, dose, and indications. And I think the dose is specifically important because there's different cutoffs depending on their age, weight, depending on what product you use. So it's really important to have a good understanding of how to look at the label of your different medications. It's always important to evaluate the max dosing, specifically like we talked about with acetaminophen and ibuprofen. And it's also important to consider dosage forms available that are appropriate and easy for caregivers to administer. Because if you have a younger pediatric patient, you're not going to want to use a tablet or a capsule. So it's important to think about liquid medications that you can use and doses that would be easy and measurable for patients and their caregivers. I know I've covered a lot of different information today, but hopefully this will help prepare you for the skills lab this week. Now I'm going to spend just a minute to kind of provide a general overview of what the skills lab is going to entail. The lab this week is going to include 3 main activities. One of the activities is going to be talking about dosing errors and having you guys practice potentially looking at different prescriptions and having to calculate the correct dose and figuring out how that should be measured. And then you're also going to look at different measuring devices and get that kind of hands-on practice to see which you think would be easier to use for caregivers and children. And then another activity is going to be looking at communication. And so we'll have some more discussion on different communication techniques with children and caregivers. And then there will also be a case scenario where you get to practice using the Quest Scholar MAC approach and the Teach Back method. So hopefully all these activities will be very beneficial for you and help prepare you for situations if you were to encounter interactions with a child and their caregiver in a variety of settings. So some general instructions for you guys for this week are to make sure that you bring your laptop and a calculator. So to summarize all that information we went over today, it's very important to make sure medications are written as measurable doses. It's really important to ensure appropriate medication devices are available. It's important to communicate with children and caregivers at an appropriate level. It's always important to look at product labeling carefully to identify dose and appropriateness of medications. And finally, it's essential to consider patients' age and past medical history when recommending the various products. So this concludes the pre-lab lecture recording for you guys, and I hope that this has been beneficial and that you enjoy the skills lab this week, and I look forward to working with each and every one of you. Thank you.